My name is Frank NEUGART. I am urologist and surgeon, and I work in the nice town Baden-Baden in Germany. I am co-editor-in-chief and one of the authors of the book Wege aus der Inkontinenz, the summary of the knowledge of the German agreement group of urologic implanters, and therefore I think that I have a good experience with artificial sphincters, and I perform such operations for more than 10 years. We have to think about the best patient we should operate with the ZSI 375. I think the best candidate is a male patient with stress urinary incontinence after radical prostatectomy or transurethral resection of the prostate, if possible without radiation in the history. The patient should be mental tough and maneuver skillfully. I think a very good indication for ZSI 375 is a male patient with incontinence after cystectomy with preparation of a neobladder. First, because you don't need the transperitoneal or paravesical approach, and second, because you can regulate the pressure and adapt it on the low pressure reservoir of a neobladder. Of course, there shouldn't be any local or general foci of infection. An urge component or subvesical obstruction should be cured first. Urethral strictures or fistulae are also excluding factors. The ZSI 375 is not suitable if the cuff position should be at the bladder neck. In my opinion, the ZSI 375 is not suitable for children, but for adolescents it may work. But I never performed the device in this group because it's a rare indication. All the patients has gone a long way of suffering before they decide to get an implantation. I think that this ain't necessary, because nearly all my patients are continent with an artificial sphincter, and they often ask me, "Doc, why didn't I undergo the operation earlier?" In German DRG system we don't have any problems with the reimbursement, all costs are covered. I performed the operation in the way Christoph Lorenz has recommended. The patient is in lithotomy position. I perform the perineal approach and the inguinal incision as usual. And there are of course also some tricks to reach the best results. The side of the inguinal incision should be the preferred side of surgeon and patient, left or right-handed, individual conditions, and so on. I prefer the left side for the pump. If you start the operation, I recommend that for the first 2 or 3 devices there should be a product specialist or surgeon in your operating room, even if you are a specialist for artificial sphincters. You don't have to learn surgery, no. But there are so much differences between the devices you know and the ZSI 375 that you will get the best results if you know all the tricks, just like right filling, correct positions, and so on. The company gives you such a good support that you should use. In Germany, for the reimbursement system, the diagnosis-related groups, the DRG, it is necessary to hospitalize the patients, and in my opinion, this guarantees a better care. To get the full cost effectiveness, patients should stay minimum 4 days in clinic, and I think that's necessary. The risk is minimal, and in my experience it is not higher as if you use devices of competitors. I have implanted about 20 ZSI 375 and I've lost no device by infection and only one of the early series by mechanical failure. In correspondence of the German agreement group of urologic implanters, it is recommended to give at least an antibiotic single shot. The most of us give antibiotics for 3 or 5 days post-operative. I prefer a cephalosporin of the second generation, but you have to choose the substance in knowledge of the local spectrum of germs. Patients often ask me, "Doc, why didn't I undergo the operation earlier?" This means more than 90% are absolutely satisfied and they would recommend the operation a friend or a relative if necessary. Be supported by a product specialist or experienced surgeon in the operating room for the first 2 or 3 devices, even if you are a specialist for artificial sphincters. Proclaim the artificial sphincter to your patients because it's a safe procedure with a phenomenal outcome. My advice for patients: if necessary, make the first move. Ask your urologist for the procedure. Look for a clinic of competence in implantation. And sometimes it is better to travel 100 kilometers or more to get the best surgeon for your disease. It is a pleasure to work with Sapphire because it's a company with good ideas. They think like surgeons and they know what patients feel and want. And the best, they are not only open for critics. If you suggest an improvement, they translate it into action in a very short time.